All right, it's rolling. Just whenever you're
okay.
ready. Yeah.
I was actually just talking to Dr. Maggio about some people are experiencing elbow pain. Some people call it like tennis elbow or whatever. And we are going back and forth on the concept of viewing, like typing and scrolling and even texting on your phone as repetitions, and the volume and the amount of tension your muscles are under every day when you're at your desk, you know, doing your daily tasks. So you kind of touch on like what that means for your muscles, you know, they never get a break.
Yeah, so I mean, I've actually had people that don't even work out or do anything coming in, you know, in their 30s with like severe elbow degeneration, and you're like, how the hell did this happen? They don't work out or do anything like that. But even if you're sitting here right now and you start to move your fingers around, kind of hold right out here in your lateral part of the elbow, these muscles never get a break. We live in a society that's technologically based, and you just spend so much time on the computer, texting, everything like that. So these muscles are held in a state of constant contraction. When a muscle is held in a state of constant contraction, it just doesn't get enough blood and oxygen. When that happens, you start to get scar tissue in there. We've talked about scar tissue before, you know, decreased mobility, flexibility issues, pain, weakness, all of that stuff. So I was saying earlier, imagine if you walked around and like, you know, flexed your bicep for 8 hours a day. Imagine how smoked that would be by the end of the day. That's what's going on in these deep little intrinsic muscles in your elbow, and they really get beat up. So people that are having elbow pain, you know, they've already worked them out all day long at their desk. Then they come in and they want to do some pulling work and grip work, and they're wondering why it keeps crapping out on them. That's what's going on.
Yeah, so, you know, pulling work and grip work is important, but, you know, that all of a sudden introduced to all the volume on top of all the typing and scrolling is what's giving, you know, some people the elbow pain on the inside and outside, right?
Yeah.
I mean,
more common what you're going to find with most people, and it gets that bullshit diagnosis of tennis elbow. So if you ever had a doctor that says you got tennis elbow, it's just classic for they really don't, it hurts here and that must be it.
Right.
So two things to avoid is definitely stay away from a doctor that diagnoses you with tennis elbow.
Yeah.
And then the other thing is the cortisone stuff.
No shots.
Stay away from shots. That's just bad stuff, and it doesn't do anything good. But basically you have two compartments to your forearm. You have your extensors, which they get a pretty decent blood supply, not a great one, so they get easily overworked more than these muscles in here called your flexors. Flexors I see a lot more in like CrossFitters and people that do a lot of grip work, but everyday people I see a lot more stuff in here. It's kind of like your average Joe CrossFitter, you know, someone that does it, you know, recreationally like 3 or 4 days a week, coming in with elbow pain and stuff like that.
Right, because they're typing. And
they're typing. It's your office worker kind of stuff like that.
Okay. So I guess next time we'll touch on, you know, preventing the elbow pain from happening, you know, and taking care of your tissues.
And how to, you know, basically how to recognize if it is a problem. We're going to take you through some basic screening methods to see if that is an issue in there on either part of there, and then just go over some common misnomers and stuff like that, and helping people understand the difference. There's a big difference between something being sore and needing a warm-up versus something that's actually injured.
Right.
And a lot of people spend a lot of time hammering away on dysfunctional tissue, and they think they're doing good, but at the same time they're actually just pissing it off and causing more problems with that.
Okay. So we will shoot a follow-up video on how to kind of screen yourself, not necessarily diagnose, but screen yourself, kind of rule some things out and bring up a couple possibilities. And then aside from the actual, you know, injury versus non-injury, preventing from getting to that point and kind of maintaining your soft tissues, knowing that you're doing a lot of volume with typing and pulling. So stay tuned. We'll be back next week.
Thanks.